Ophthalmic drugs can be used to treat a variety of conditions related to the eye. They come in several forms such as topical drops and retrobulbar injections. Stella the dog was brought into the vet clinic by her owner, Brad Pitt, who has noticed Stella would often paw at her eyes and whimper. Upon examination, the vet tech noticed Stella had discharge coming from both eyes and that they looked red and swollen. The tech also noted ulceration in Stella's right eye. The tech performed a Schirmer tear test to assess Stella's tear production. In each eye, the tech placed a special folded strip and removed them after about a minute. Bad news, Stella's tear production measured 2 millimeters a minute, whereas the normal range was 15 to 20 millimeters a minute. Then the vet examined Stella. She diagnosed the patient with keratoconjunctivitis sicca and a secondary corneal ulcer. Keratoconjunctivitis sicca, or KCS, is a condition where tear production in a patient's eyes is lower than normal. Also commonly known as dry eye, KCS can be asymptomatic, but it can also cause chronic mucopurulent conjunctivitis, corneal ulceration, and scarring in the eye. To treat Stella, the vet prescribed 2 medications. A. Artificial teardrops, which would treat Stella's symptoms of irritation and dryness at her eyes. The vet recommended that Mr. Pitt look for an over-the-counter product since no prescription was needed. And B. Cyclosporine, an immunomodulating agent to treat the probable cause of Stella's KCS. KCS in dogs is thought to be caused by an autoimmune condition of the lacrimal and nictating glands. According to the Merck Veterinary Manual, cyclosporine treatment increases tear formation in about 80% of dogs, with Schirmer tear test values less than or equal to 2 millimeters wetting a minute. Stella would most likely need to continue drug therapy for the rest of her life to prevent the KCS from returning. The KCS also meant that Stella could not be given certain drugs in the future. For example, atropine and tropicamide, mydriatic drugs commonly used during retina exams, could not be administered to Stella now since it would worsen her already low levels of tear production. Mr. Pitt remembered that his other dog had been given steroid eye drops once for dry eye. "It worked really well," he said. The vet tech replied that although antibiotic steroid drugs could be used to treat KCS, they would be contraindicated for Stella since it would prevent her corneal ulcer from healing. However, Stella could be switched to pilocarpine, a lacrimogenic drug, if she was resistant to the cyclosporine or if any neurologic causes for her KCS were found. 2 months later, Brad Pitt's children brought Stella back for a follow-up exam. Stella's symptoms of KCS had greatly improved by the cyclosporine and artificial tears therapy. Even better news, she no longer had low levels of tear production. Stella was once again a happy, healthy dog with beautiful eyes and would continue her drug therapy until her symptoms were completely resolved.
Hey, where did we go? Days when the rains came down in the hollow, playing a new game.